So today we're going to talk about ways to not lose your accent. If you just graduated nursing school and you are a new grad nurse, or even if you're an LPN, I know for a fact that you want to keep your license for years, because I want to keep mine too. Okay, so we're gonna go over some little tips and tricks that I've used so far in my journey of nursing, and I would like to share them with you also so you can keep your nursing license. I'm not gonna say, like, disclaimer, this will prevent you from losing your nursing license, but it will help you a lot to not lose it. Okay, guys? And if you see me looking down on my phone, of course, I'm just looking at my notes. Number one, stay current and consistent with continuing education. Like, that is why the job always have you doing health streams, which is so annoying, so freaking annoying. But I do understand why, because things change, policies do change. You have some policies that are gonna be standard regardless, but you have some stuff that do change over time, especially within the facility, and you want to stay current and consistent with it. That's why, your job have time limits on your health stream. Don't just click through them, especially those like with the infection control and all this stuff. Don't just click through those. Make sure you are actually like reading them and understanding them, because even the other day, like at my hospitals, they stopped using like red caps to cover the IV lines. Like, now you should swab it with alcohol wipes for like 15 seconds and then let it air dry for 15 seconds before using like the port for the line. So, simple stuff like that can be avoided through education. You need to know. Number two, know your scope of practice. LPNs, know your scope of practice. Know your scope of practice. RNs, know your scope of practice. Because it might sound dumb, but there's some nurses out there that maybe feel like they're the doctors or something. I don't know. But y'all need to get it together. Know your scope of practice, right? Especially LPNs, this is more surrounding for you. Know what you can and can't do. They teach you all the time in school. And if a nurse comes to you and be like, hey, I need you to get this done, and you know within the fact that you're not supposed to do it, say no. And it is okay to be respectful to a nurse and let them know, like, I'm not supposed to be doing that and I'm not doing it. And I will leave that right there. Number three, document accurately and thoroughly. And I'm gonna say that again. Document accurately and thoroughly. Guys, doctors are not our friends. They are not our friends. I'm gonna say it again because I don't know if you're hearing me, but doctors, PAs are not your friends. Then again, let's put this in there. Nurses are not your friend. Document like your life depends on it. Document every single thing that's being done on your patient. If something was put in, document it. If something was given by the doctor or done by the doctor, document it. Document like your life depends on it. And guess what? Not even that. Document what you have done. You, the nurse, have done. Because you know what? There have been instances, I know for a fact, that they're like, oh, she did not do it. If it's documented, it's done. If it's not documented, it's not done. Be concise. Do not overchart. Do not overdocument, basically. Be concise. Summarize. Don't overdocument. If you are going to put something that is wrong, make sure you document that you fixed it. You cannot be putting that, hey, this thing is wrong, or there's a wound on the patient. What did you do? Like, okay, you saw that the patient have a stage 2 coccyx wound. What did you do to fix it? And that's how I look at things now. Like, I'm always telling myself, like, I'm never gonna go to prison. I'm not going to no prison. I don't know about y'all, but I'm too pretty to be in prison, and I like my life a certain type of way. And I truly believe that all nurses should be looking at life that way. If you are documenting something that is wrong on a patient, please document that this is what you've done to fix it. Be concise with your charting. Do not over document stuff. Don't even be put, like, I'm not the type of nurse to be putting, oh, nurse Samantha didn't do the bath on the patient, so I had to do it. Stuff like that. Those are petty stuff. We don't need that in a patient's chart, and the patient is going to see that. Like, nurses' notes, they see that. Doctors' notes, they have access to that. They have access to all of their medical records. So always remember that the patient is seeing everything that you document. My battery died. So I know I was on a rant on documentation. Follow your facilities, procedures, and guidelines. Guidelines are there. There are rules that we have to follow. Just follow them. It is as simple as that. If they say John is a boy, John is a boy. Leave it at that. Oh, AccuCheck every 1 hour. AccuCheck every 1 hour. That's just how it is on an insulin drip. You can't change it. That's it. If they say heparin drip, you gotta check the PTT every 6 hours or every 8 hours. That's how it is supposed to go. Know your guidelines for procedures. If you're doing something for the first time in the facility, I would just advise you to go look. Most of the time the facilities have a main page, and it does say policies and procedure on the page. Like, you see, the hospitals know how to cover their asses. They're like, we give y'all everything. If you don't want to go searching for it and looking for it, that's y'all's business, okay? But they do provide everything for us to be safe and have our license protected. Communicate effectively. There's no need to be rude in nursing. I do not know why there are so many nurse bullies in nursing. I don't know. I think just something is wrong with persons these days. I think people are just going through some stuff that maybe they need therapy. I really don't know, because I have no reason to be mean to a nurse. I have zero reason to be mean to a nurse. Like, my profession is my job and I love it. But let me tell you something about Samantha. When Samantha get home, honey, the job is zero. And my family and God, all wrapped in one, is my priority, not my job. Okay? And then that's the biggest thing for people, is that they don't know how to differentiate work and home. And when you come to work, it's not a place for you to be taking out your frustration on people. But if it becomes to a point where it is disrespectful, zero tolerance for Samantha. I'm not going to tolerate disrespect. You're not going to disrespect me and feel like, oh, it's going to... No, I'm going to respectfully answer you. And if the disrespect continues, I'm going to make sure that I keep a track of what you say and write it in a nice, sweet email to HR. Like, I do not tolerate disrespect. And if it becomes a case where this particular person is just constantly disrespecting you, then you need to make sure, like, it goes. Follow your chain of command. Go all the way up if you have to the CEO. If nobody's doing anything about it, then hell, just leave the goddamn job. Leave it. Because if you're going to fight and you've gotten to the CEO at this point, or the chief nursing officer, and nothing is being done, then that means you need to leave the hospital, because it is messed up. But just make sure you are doing the right thing. You're respectful, and you're nice. Don't be a bully. Don't be a bully. Nobody comes into a profession to be bullied. Come on, guys, let's get it together now. It is 2024 and we still have nurse bullies. It's just so atrocious, and it is also disgusting. I think I'm at number 6. Maintain patient confidentiality. Oh my god, I could talk days upon days about this. What is wrong with you guys and TikTok? Like, social media has gotten out of hand when it comes on to nurses videotaping patients and patient information. There was a video the other day. Oh my god, I don't even remember. I gotta go find. I don't remember. Like, if I remember the nurse name, I'll put it there. But apparently she went to like preschool or whatever with this girl, and she came in on a patient as a patient, and she decided to post her chart on Snapchat. What is wrong with y'all? What is going on? There's no video taping in the hospital for sure. No social media recording in the hospital. If you want to record on social media, go home. Like what I'm doing now. Go home in the vicinity of your freaking home. Or frig, if I've seen nurses do this all the time. They're in the med room and they record. Like, know your facility's guidelines. Some facilities are more friendlier than others, but don't put patients' information in your videos. Like, HIPAA is self-explanatory. It is the patient's information and we protect it at all costs. Of course, we don't go home with S-bars because of HIPAA. We have to put them in the shred bin because of HIPAA. We don't just leave patients' charts lying around because of HIPAA. It is there for our protection, guys. Like, I wouldn't even have thought that I would live in a day and an age where nurses are doing this, and it's really sad. Number 7, but be mindful when you're doing medication administration. I always say this. If you don't know the drug, go look it up. Google is right there at your fingertips. Go look it up. But then again, that is even minor compared to make sure you're having the right patient. Like, that is why the scanning system is in a hospital for a reason. I don't know what is wrong with these nurses these days. Oh no. I'll scan it later. Scan what later? Are you okay? Are you guys fine? Because me, Samantha, I'm scanning for dear life. I'm scanning. I'm scanning. And guess what? If the barcode for the med don't work, you know where Samantha is going? Back into the Pixis. I'm going to grab another one. And I'm scanning it. Even though I know it's the right medication. Because you know what? Hell breaks loose and something happens. You always have documentation that you did scan something. Like, they can't say, oh, you didn't give it and this is why this is happening to my family member. And no, I don't play those games, guys. I can't. I'm too young. I'm too pretty. I can't go to jail. I always tell myself that. Like, I can't. Make sure you have the right patient. And even if you scan the armband, make sure you ask the patient if the patient can talk. Tell me your name. Tell me your date of birth. Make sure it verifies name, date of birth. Computers are there, but they do make mistakes too. A couple months ago, there was this patient that came in that had two different MRN numbers. Same name, 2 different MRN numbers. And lo and behold, of course, the doctor put the order under the wrong MRN number. So that had to be fixed. Like, computers are there, but they do make mistakes. The system is in place, but the system can make mistakes. So you make sure you're in the right clarity, right mind when you go to work. So you cover yourself and don't make a mistake. Always follow my 5 rights, for sure. Never let me down. And I hope you do too. I think I've been through everything. Last but not least, you hear me? Last but not least, last on the list, report. If something is unsafe, report it. If you're getting an unsafe assignment, speak up before taking report. Don't go take report. Do not go take report. This is for my new grad nurses especially. Do not go take report. report and then complain about the assignment. That's not how it works, honey. No. If you are getting report and you're like, why the hell am I getting all these drips? Like, what is going on? Like, why does all my patients have drips? And you know for a fact, like you were there before, you have the little old lady that's there, you have the young man that's there that only has a dressing change, you have that one that's alert and oriented awaiting surgery. So why the hell do I have, like, 6 drips? Speak up. Speak up. If you go in and every night you have the heaviest patients, like they're just giving you the heavy, speak up. I am from Jamaica. And I am sorry, I do not tolerate. I just cannot. That's how I was grown. And I just cannot tolerate when I'm being treated unfairly. And I am going to talk. I am going to talk. And before I end this video, I just want to say that being in a CVICU, I did hear a comment. And the comment was that you come to work, do your work, and go home. Honey, let me tell y'all something. It wasn't directly said to me. It was said out in the air. But I took it how I wanted to take it. Be careful of these people that you work with. Protect yourself at all cost. Watch your back. They're not your friends. They'll throw you under the bus in a second. The second that they can, they'll do it. And I'm just being honest and I'm being real. Be careful. Watch your back because they're all heading to stab you in the back. Especially if you're young and you're very ambitious and you know what you want. Most of it is jealousy, I feel like. And in Jamaica we'll say bad mind. Bad mind people. Yeah. Guys, I have given you lots and lots of tips on how to protect your nursing license, and I'm really hoping that it was very helpful, and I'm hoping that you apply them day by day. Okay, it's your girl Samantha Renee, and watch out for my next video next week. And you can also follow me on all social media. I think it is Nurse Sammy. Yeah, it's gonna be linked in the next screen.